Just to tell you a little bit about who we are, the National Consumer Voice for Quality Long-Term Care. We are a national nonprofit advocacy organization. We have been in existence for 45 years. We're celebrating our anniversary this year. And we work with and on behalf of individuals receiving long-term care and services, both in congregate as well as in community-based settings. We advocate with nursing home residents and assisted living residents. We support and advocate for public policies that support quality care, quality of life, and protection of rights. We empower and educate consumers about their rights and about how to advocate for themselves. We train and support advocates, including long-term care ombudsmen across the country. One of the projects that we house at the Consumer Voice is the National Long-Term Care Ombudsman Resource Center, and we're thrilled to be able to work with ombudsmen across the country at both the state and the local level. And we also promote the critical role of staff and best practices in facilities. We really believe that in order to advocate for quality care and quality of life, you really need to know what that looks like. And so we support staff in all that they do, and we look for best practices on a regular basis. More about that. But as you know, all individuals living in long-term care facilities, including nursing homes, are entitled to rights as individuals. They still retain and maintain all of the rights of being a citizen of this country, of living in this country of the United States, but they also have been afforded rights through state and federal laws. And those rights include having a dignified existence, meaning being treated with consideration and respect, recognizing a person's individuality, being able to exercise their rights without interference or reprisal, and to have access to quality care. They have the right to self-determination, choice in what their day looks like, what their schedule looks like, who provides care for them, including their physician. That's a really important one because so often people don't know that they have the right to choose their own physician. When a person lives in a nursing home, that doesn't mean that they should be just adhering to everybody else's schedules. They do have the right to reasonable accommodation of their needs, their preferences, to develop their own care plan and to be a participant, an active participant in the development of a plan of care that actually reflects their needs, their preferences, and goals. To request and refuse treatment. This is a really important one, particularly as we talk about abuse and particularly chemical abuse, because so often we find that residents may be given medications that they have not consented to or that might not be in their best interest, and they need to know what the challenges are, what the benefits are of the treatments that they are getting, and they have the right to provide informed consent to refuse treatment that they don't think is in their best interests, and also the right to raise grievances without discrimination or retaliation. They should not go into a facility and be afraid to raise concerns or raise challenges, thinking that they might be discharged or asked to leave. They do have the right to raise those concerns and to have them addressed by the administration, by the staff, to find a solution that works for both the resident and the facility. The residents have the right to be fully informed about the type of care that they get, the risks and benefits, as I mentioned, of proposed treatments, and to be notified of their rights and of their care in a language and in a manner in which they understand. I'm so excited that the program today includes interpreters, includes closed captioning, so that we can reach a wider audience and so that there actually is the ability to provide information to people in a manner in which they are able to understand and accept it. And that's something that should be happening in long-term care facilities as well. If you speak a different language or if you need assistance with interpretation as a resident, you have the right to those services. And also access to others is really important, including visitors of their choosing, access to the Long-Term Care Ombudsman program. The Ombudsman program is one of those few people that does have the right to immediate access to residents, and that's an important right that residents have. Also to participate in resident groups like a resident council or to meet with other people in their communities. A note that, you know, when we think about long-term care facilities, generally we think about older individuals that are living in these facilities, but remember that there are people of all ages living in long-term care right now, receiving long-term care and services. And every resident, regardless of their age, is entitled to the same rights as everyone else living in the facility. So as we think about looking at some of the concerns that I raised, there are things that we can be doing to prevent abuse, to provide interventions that will support residents, and engagement of residents and families is really, really critical, particularly, but being active participants in the care that's provided, focusing not just on the needs of what the individual requires in terms of their care needs, but also their preferences in terms of how they spend their day and what their schedule looks like, what kind of treatment they receive. All of those things are really important to keep front of mind and to be asking questions about, to stay engaged in the care that they're receiving, to know what it is that they need, so that you can advocate for them as best as possible to ensure that their needs are being met. Think about the cues of the resident and what it is that they're trying to tell you if they are communicating with you in ways that might be other than verbal. Some residents who have difficulty communicating verbally may communicate with you about through actions or through reactions to through trying to get their message across in different ways where they might not be able to speak to you. And so understanding what those cues are can help you focus on what they are experiencing, whether or not they're receiving good care, whether something's right or not right. Really pay attention to the cues of the individual. So we do know that behavior is a form of communication. So if you're seeing changes in behaviors over time, then it's important to ask questions about what that might mean. Know the residents' signals or cues that they may traditionally have been giving to you. Get to know the person. Certainly as family, you should be knowing the person and sharing information about that person with staff. But if you're an advocate going in, talk to staff. Try to communicate with others who may know that resident to try and assess what it is that that person is trying to talk to you about. It's by knowing the person, it's by staying engaged in their care, by staying in effect, communicating with them on different levels, that you are able to not only prevent abuse, but to be able to intervene if you're concerned about what you're seeing, concerned about issues of neglect, for example, or poor care, or even depression or anxiety that you may be seeing from residents. It's important to be staying engaged and asking questions of them about what's happening and how you can best help.